Broadcast is now starting. All attendees are in listen-only mode.
Good morning. This is Jennifer Lisanti, the Director of Sales at Beere&Purves. Thank you for joining today's webinar. We hope everyone continues to be healthy, patient, and sane during this very stressful time. We know you have a lot of demands on you, both personally and professionally, where your clients need you more now than ever before. A couple of housekeeping notes before we get started. Everyone is on mute, but we would love questions. Just put them in the chat box. I'll look at them at the end of the presentation today, and we don't always get a chance to get to all of them, or some of them need research, but we always do circle back to the person requesting the question with the answer. We will be sending out a presentation, a copy of today's presentation, as well as a recording. We'll go ahead and move on to the agenda. So today's agenda is a little different than the other two webinars I did earlier this week. We'll do a quick update on the B&P operations. We're going to cover some general carrier policies and then move into the specific solutions that each carrier, medical carrier, and a few other ancillary carriers have implemented based on COVID-19. We're going to review the content from the frequently asked questions at the employer level from my previous webinars, but we won't be going over legislation information today like we had been earlier. And then we'll share the B&P resources at the end as well. So that's today's agenda. As I said, this is our third webinar of the week. The topic is a little different, really focusing more on what the member coverage is from our carriers. The first two were responses to all the questions you guys were getting bombarded with as far as the questions your employers had to the carriers. So we've been summarizing that, as well as a summarization of the legislation today. To date, you probably know that the Senate has passed a third federal legislation. It's gone over to the House, and they expect to pass it tomorrow, and then the president is said that he will sign it. So once that has officially passed, we'll be summarizing that for you as well, but we're just not going to cover it today. Today is going to be, well, we can't because it's not passed, but today is going to be the member level and a summary of all those questions your employer groups have had from you for the carriers. If you have any requests for future webinar topics, we'd love to know what they are. You know, we're here just to help you guys through this trying time, and we'd just love to get feedback from you on what you're looking for. So the first topic is a quick update on B&P operations. Just like everyone else, we're working from home, and really it's business like usual. You know, nothing's changed. Keep emailing us, calling us, etc. No, the reps are not going out to your houses giving you broker updates in person, but they're definitely available virtually. They can do broker education meetings like normal, and they meet with you. They can talk about, you know, specific sales strategy on specific groups. When you do have sold groups, we can certainly do online enrollment meetings. And we've given them some technology to make that process a little easier. So we've implemented Calendly, which is a way for you to quickly just request time with your B&P sales rep. It can be as short as 15 minutes or up to an hour, whatever you need. And it just mitigates the back and forth on when you're available, I can do this time, confirming, et cetera. It's just a quick way to do it because we know you have a lot on your plate. And we're using GoToMeeting as well to do those meetings that I mentioned, the virtual broker meetings, enrollment meetings, sales strategy, et cetera. So we're still here for you in the same capacity as always, just not in person. So the main topic of today's webinar is how are our carriers handling COVID-19 at the member level? So big picture is all the carriers started announcing this, and then it was mandated by the federal government that all testing and associated office visits for the testing for COVID-19 is going to be covered at 100%. So the member doesn't have to pay anything for the tests or associated office visits, whether that's urgent care, emergency room, etc. No prior authorization is required, and there's no medical management requirements either. So the main thing is to call, which we'll talk about a lot today. So that's what was happening, is the testing and the associated office visits. With the testing, everyone's consistent. It is free to the member. In general, and I'll tell you why I say that now, in general is if a member is diagnosed with COVID-19, actually needs treatment, so including going to the hospital, et cetera, that's when the normal plan benefits would kick in. Their deductible, their coinsurance, up to their annual pocket max, et cetera. There's one big change to that, and just as of this morning. So if you haven't heard already, if you need any type of medical coverage care, everyone is encouraging you to call first. Don't go to your regular doctor for a physical exam. Don't just show up at the hospital, etc., unless you have called first. Unless it's a true emergency, then clearly just go get taken care of as soon as possible. You'd probably be calling 911. But the number one thing is to mitigate the outbreak. They want to make sure that you're calling versus showing up in person, and that's for any type of care except for a true emergency. So as a result, the telehealth providers are very busy, but they can help advise you, guide you on normal, day-to-day stuff, whether your small child, needs a pediatrician visit or if it's a COVID-19 concern. There are lots of programs out there for telemed that are very busy right now. So all of our insurance companies have telemed like Teladoc, Life Health Online with Anthem, Amwell, Doctor on Demand, etc. There's lots of services, and now what's going on because of COVID-19 is that the carriers are allowing your normal doctor, if they have the capability to do a telehealth exam with you, they will let them bill the insurance company for that visit. But we'll get down to the specifics by carrier in a second. So HEAL doctor visits. HEAL is a program that all of our medical carriers have, and it is like concierge, old school. The doctor actually comes to your house for an office visit. Because of COVID-19, they're not currently coming to your house, but they too are available for telemed. So it's just another avenue, another resource to get telemed help for any type of service. It does not have to be COVID-19. HEAL doctors cannot do COVID-19 tests, but they can coordinate the testing for you. So if someone has the symptoms, they can book the telemed with the HEAL doctor, just like they used to call and have the HEAL doctor come to their house in certain geographic areas. Effective March 24th, as I said, they're no longer coming to your house initially, but they're just an additional source. All right. So now we're going to move on to the specific carrier information, starting with Aetna alphabetically. So you probably remember that Aetna is now a subsidy of CVS. So when you see CVS in the news, that is Aetna as well. And the thing that was announced this morning is that Aetna has announced for their commercial members through June 1st, they are not only now waiving the cost for the testing for COVID and the associated office visits, et cetera, but actually for all inpatient hospitalization care. So they're waiving deductible, coinsurance, et cetera, for members if it's COVID specifically related. So that is big news. We'll see if any other carriers follow suit, et cetera. I know there's not a ton of membership with Aetna in the small group world, but just be aware that's the big announcement they've announced today. For Aetna, they too have Teladoc. They are waiving the Teladoc or the telehealth for COVID as well as any other concerns. So not all carriers are doing that. So Aetna is waiving their telemed costs for COVID-19 as well as anything else, including behavioral health, through June 6th. They are also, like all the other carriers, are going to be waiving the early refill limit. So there's a lot of prescriptions that you can't go in within 30 days and get a refill in the normal days, but of course we're not in the normal world right now. So Aetna is allowing you to get those prescriptions earlier because maybe you're trying to mitigate, obviously, how many times you go to the grocery store right now, and if you can go and get your groceries and your prescription at one time versus having to go back a week later just to get your refill, that doesn't seem to make sense. So if you are diagnosed with COVID-19, one thing that Aetna is doing that's unusual is they're actually sending care packages to the member. It has items in there to help them recover and personal and household cleaning supplies, which are very hard to find right now. So that's a nice feature that Aetna is providing to their members. Second slide on Aetna is they're proactively reaching out to their most at-risk members, trying to provide that additional support. Because Aetna and CVS are related now, the CVS pharmacy is actually waiving charges for home delivery for prescriptions. There's a time frame for this. So it's March 9th through May 1st currently. We'll see if they extend it. But again, CVS pharmacy is waiving delivery fees at this point in time. Aetna has opened up a crisis response line for all their Aetna members. Obviously, everyone is, as I said, very stressed. A lot of anxiety can be going on, especially for certain members. So they've just opened up an additional line to help take calls and help provide some support. Aetna has expanded their 24/7 nurse hotline, so they're not doctors, but it's nurses who have been given additional support for COVID-19, et cetera. And Aetna is providing quote unquote resource for living. It's a toolkit actually for the employers for COVID-19 materials. So that is Aetna. Now we're going to move on to Anthem. So Anthem too has a 24-hour nurse line, not doctors, but nurses, and they've been trained on more detailed information to help with the COVID-19 information. So feel free to call them as well, or the normal Live Health Online telemed. In addition, something unique to Anthem is they recently rolled out a new member app. The new member app is called Sydney, and what they've done is they've given additional support on the Sydney member app specific to COVID-19. So they've created a risk assessment. So you go on there, ask you questions, et cetera, and then you'll be connected to a doctor after you've taken the assessment. So that's just a great feature. Sydney's a very user-friendly, easy member app to use. I've used it myself, and it's very user-friendly. So like Aetna, Anthem is also going to waive costs for all telemed through June 14th on Live Health Online, as well as if your regular doctor can do a telemed visit with you, including behavioral health. Now for Anthem, they're stating it's for acute services as well as behavioral health, but they'll waive it for acute and behavioral health in addition to the COVID-19 concerns. Another slide for Anthem here is they too are going to relax refill limits. So if you normally have to wait 30 days specifically to get a new prescription, they're going to make that a little more lax, again, making sure that you can coordinate your trips to the grocery store and mitigate how many times you're out of your house at this point in time. The second bullet point here, not trying to cause concern at all because there should not be any concern. I know Anthem and United Healthcare have specifically said they're looking at the supply of prescriptions, and at this point in time, there are no prescription issues at all. But Anthem did make a statement that if there becomes supply issues for certain prescriptions, they're going to open up their formulary so that it's okay that you get other options than what might be on the normal formulary list. So just something they're thinking down the road. Probably won't need to happen, but just be aware that they're really thinking things through. Also with Anthem, all Anthem medical members have an EAP always. So that's just a quick reminder that Anthem medical members have an EAP included in their medical plans, but they too, just like their Sydney app, have built out their EAP program to provide additional COVID-19 specific information. All right, HealthNet. Sorry, I know some of this stuff is repetitive, but just want to explain what everyone is doing because it sometimes is a little slightly different. But HealthNet 2 is just reminding everyone that they have their 24-hour nurse advice line, as always. They also have teledoc services. And what's unique to HealthNet is they've said if you are a quarantine member and you really need to stay in your house at all times and not go even to the grocery store or pharmacy, you can contact HealthNet and they can help with an emergency supply of medication so you don't have to go out and about and get it. They too are allowing early refills on their prescriptions. Moving on to Kaiser. So Kaiser, as everyone is probably very familiar with, is great on and kind of leaders in the telemed world. So they've always had, especially in recent history, great access to their doctors, et cetera, through phone, email, video, et cetera. They too have a 24-hour advice line, again, encouraging people to show up or call, do not just show up for care. They have mail order, always have, and they're just trying to encourage people to remember to take advantage of that. Something new and unique that they're reminding their members of is they have a My Strength app. Again, additional support to help people during this stressful time. It's got inspirational resources, etc. And then they too have put a lot of time in creating some YouTube video series information. It's a 5-part series specific to COVID-19. The last medical carrier we're going to cover is United Healthcare. As I said on my webinars earlier this week, a unique thing that United is doing is they are actually going to give a free EAP to anyone. Any person that calls that phone number can get help. That just means you do not have to be a United Healthcare member. Non-United Healthcare members can still call this number for access to an EAP program. So If you're a United Healthcare member, they have the telehealth as well. They always have. They're making it free to you through June 18th. The one unique thing with United is it is specifically free for COVID-19 concerns. If you're using telemed, which they do encourage you to do, if your regular doctor can do it, the doctor can bill United. If it's a non-COVID-19 related visit, there may be normal cost sharing, like your normal copay to see your doctor. UHC has always had multiple avenues for telehealth, so they use different vendors, TeleDoc, Doctor on Demand, and MWell. So they're very well sourced on providing those services. They too, United, is allowing you to get early refills on your prescriptions. One thing that United has gone out of their way to announce is that, unfortunately, a lot of non-elective services were canceled in certain areas. So maybe you were going in for your knee surgery, and since it to prep the hospitals for capacity, they canceled your knee surgery. You do not have to get another prior authorization for that, assuming it's done 90 days from the time of when the procedure was postponed. So that's just something you don't have to worry about going through that whole thing again. If it was approved the first time and you are able to get that procedure done 90 days from the first time you were supposed to and it got postponed, you do not have to get a new prior authorization from United. United is going to be sending out customizable letters to employers and brokers to share with employees, because that's been a big conversation, is how is this information getting to all the members and employer groups. All the carriers have put up microsites with their COVID-19 information, which is probably the best source, because you've noticed everything's moving quickly around here as far as the virus itself, legislation, and how the carriers are responding. So that's probably the best source. And then B&P has consolidated all that information as well, which I'll show you here in a little bit. All right, so our exchange member solutions, meaning CalChoice and Covered California, since they're kind of view them as the administrator for the healthcare, they're leaving all the information up to the providers that are within the exchanges. So they've provided that information, and we have it consolidated as well, but you don't have to think, oh, I have Anthem through CalChoice. Is it going to be different than what Anthem is doing direct? It's not. So they're just leaving that information up to the carriers to communicate. All right, a quick notes on some ancillary information. So with the ancillary, starting with Guardian, if you have 3 lines of coverage with Guardian, you get an EAP included, at least in the products that we sell at Beere&Purves. What's unique to Guardian is they actually have teledentistry. So a lot of vision and dental providers have been canceling non-emergency services, eye exams, your teeth cleaning, etc. Unfortunately, but through Guardian, they actually have teledentistry, and that's going to be available through May 31st for their members. Quick reminder with Guardian too is on their vision services. We know you probably can't go to your ophthalmologist right now and get a new eye exam, but if you need new hardware, they do have online programs like Iconic, for example, through VSP, that you can still order glasses, etc. at this time when you're sitting at home. For MetLife, they too have the EAP program, and I know this is not ever very fun to talk about, but it's very important, especially during this COVID-19 crisis. A reminder from MetLife that the optional life customers have access to will preparation services, which is always important, but definitely when there's bigger concerns now than ever. Also, their life insurance policy customers have access to grief counselors, which in that time of need is very important to always have someone to just listen and walk you through and be there for you. With Principal, they have an EAP through Magellan as well. The last bullet point is more in general. All of our carriers have said that COVID-19 is included in their contracts. No one is coming out and saying that COVID-19 is excluded, especially like the life insurance companies. They're saying, no, it's not excluded. However, certain voluntary coverages may not include it, because if you think of an accident, it's COVID-19, unfortunately, is not an accident, and it wouldn't qualify under the critical illness plans that we've heard of, but it would qualify under the hospital indemnity plan. So just a quick little note about those types of coverages. COVID-19 most likely, can't always say always, but most likely from what our carriers have said will qualify under the hospital indemnity, but not under the accident or critical illness plans. All right, so that was the bulk of what we were going to talk about today. We still have some time, so I'm going to go ahead and do a quick summary of the carrier FAQs that I have covered in the previous 2 days, because the information still continues to be rolled out and we are still missing some information from just a few carriers. So if you want to hop off, feel free, no offense. But if you want to stay on, we're going to go ahead and continue with this information, and then I'll look at questions at the end. All right, so how are carriers responding? Everyone has been very busy, obviously taking care of their members, which is first priority, and then tackling all the employer questions that you've been getting bombarded with as well. So here's what we have so far. Aetna is answered all the questions we've asked. Anthem has as well, except for plan downgrades. CalChoice is having a second call this morning with all their carriers so that then they can release their information. They always have to get the carriers on the same page and then move forward. Same thing with Covered California, but Covered California has released some partial information, which you'll see on this presentation. With HealthNet, Kaiser, those are both pending. We do have some information on premium leniency with Kaiser, which we'll address. United Healthcare is also complete. Choice Builder and Delta we're waiting on. Guardian is complete like Anthem, except for the plan downgrade question. And then MetLife, Principal, and VSP, we do have partial information from them as well. All right, so starting with the hot topics. The first topic is we have sold groups for April. Everyone had to, at the last minute, scatter and either work from home or not working, so it's pretty hard to collect new business enrollment material from everyone for April. So how are the carriers responding to that? Interesting, Aetna, who was always typically very tight on their new business deadline submissions, and they used to be having new business submission deadline of April 1st. Yesterday actually announced that they're going to have official deadlines now that match with the other carriers, which will be the 5th of the month for the 1st of the month effective date and the 20th of the month for 15th. And that's going to be their ongoing. That's not like a COVID-19 deadline. That's their new policy for now. Anthem is the only carrier, and only medical carrier, I should say, that has officially extended their deadlines for both March and April. They're letting you go until the end of April to submit your April 1 new business submission. We all know, because we're in the industry, that the sooner rather than later, clearly, especially at this time of need where members will be loaded into medical eligibility and RX eligibility, but Anthem is the one medical carrier that's come out and given you that flexibility to date. So be aware of that. Guardian is the one ancillary carrier that has also officially extended their April 1 deadline to April 15th. Again, always sooner rather than later is better with all the carriers. They do have one request that if you're selling Guardian Life and or disability, they're going to need to get a letter from the employer stating that there's no pending claims. And they did want to remind you that the rates for April are actually good through June 1. So if you just want to delay the effective date, that's always an option as well, without an effect of the rates. The next 4 carriers that are listed on the 4th bullet point have all said, we're not going to officially extend our deadlines, but if you need flexibility, just give us a call. So just give B&P a call. We kind of always have some extended deadlines behind the scenes anyway, and we can work with you. Principal went even further and said they might be lenient on some signature requirements. They'll probably circle back and make sure they get that, but just in this time of the mad dash scramble to working from home, there might be some leniency initially. At this time, I do want to remind you guys that we have BP Enroll. It's a free online initial enrollment program where if you're moving a group from, say, Blue Shield to United or Anthem, et cetera, that you can give us information for the employees, their email addresses, what you sold, contributions, et cetera. We'll set it up in the system. Then each employee gets their own email where they log on, they see what benefit offerings are available to them, including contributions and benefits. They make their election, either enroll or waive. We're able to monitor that behind the scenes of who's gone on, who hasn't, so that we can, not bugging everyone, only bug the people we need to. And then we can take that information, and always with online enrollment, it's more complete, it's always legible, et cetera, and we can get much faster approvals through there. But definitely just a reminder that you have that available to you on new group submissions. If you don't have your own online subscription, there'd be nothing beyond the initial enrollment, but this is a great time at this point where everyone's scrambling to collect everything. And I do want to say, thank you very much for the April 1 business. It's actually been a very good month for us, and we appreciate the business. And let us know how we can help you with future months, since I know there's going to be a lot of volatility in the market. All right, so the next topic is, are carriers offering a special COVID-19 enrollment period? And I first want to jump to the individual market. Covered California, the individual state exchange, is allowing people to enroll from March 20th through June 30th. So no questions asked, that time period had closed. They opened up this individual state exchange. People can enroll at this point in time. They'll be effective the first of the month following their enrollment. So if you enroll in March, you're going to have an April 1st effective date. If you enroll in May, you'll have a June 1st effective date. And a reminder that as of January, the state of California has more enhanced subsidies available for members potentially. So the individual exchange is back open for people that need it. If you have small groups, however, some of the carriers are opening up a special enrollment period for the small group. So what that means is if you have a group with one of these 3 carriers listed here, Anthem, United, or Covered California, if an employee initially waived, declined, had a valid reason, didn't have a valid reason, et cetera, and they want to now come on to the small group policy, they can. With Anthem, you see the dates are March 23rd to April 3rd. With United Healthcare, it's March 23rd to April 6th. United Healthcare will require proof that the employee you're moving onto the plan mid-year, no questions asked, is actually an employee of the employer, so just be aware of that. But both Anthem and United will take people, and it will be effective April 1st. Covered California, the group exchange, is a little different. They too have an open enrollment period as well. It just goes longer, so it's to June 30th. And it is for people that, just like with Anthem and United, for people that previously waived can come on mid-year, qualifying event or not. Aetna has said they are not going to do a special open enrollment period at this point in time. And the ones we're waiting on are CalChoice, HealthNet, and Kaiser, which will be very soon. All right. Will carriers be lenient on premiums? We know small employers don't have a lot of cash flow, and at this point in time, unprecedented time, it's even harder. So we're getting bombarded with these questions. You probably heard that March 18th, the California Insurance Commissioner did request insurance companies to extend a 60-day grace period for premium payment. Be aware most of our carriers are actually regulated by the DMHC, not the DOI, and this was a request, not a mandate. But carriers are still responding. So if you look at the third bullet point, we have listed there the carriers that have officially come out and said, yes, we will give, instead of a 30-day grace period, a 60-day grace period. That's Aetna, Guardian, MetLife, and Principal. So if you owe for April 1, you normally have until the end of April to pay that April bill. Now with those 4 carriers, you have through May to pay for April. Guardian has made a note that they will not pay claims until you've paid the premium for those months. But if you do pay that premium within that 60 days, they will pay the claims, of course. Kaiser has announced that they will not term groups due to late pay for the month of April specifically. They're coming out very soon with additional information. Obviously, if a group can pay, they should. It should not be a free-all for everyone, clearly. But just be aware if people are really having a hard time, Kaiser will not term groups because of late pay for the month of April, and more information to come. Anthem and United said, we understand there's hardships here, and call us and we'll handle it on a case-by-case basis. So be aware, Anthem and United are open, but it's not a blanket 60-day grace period for any means. But give them a call. This is just my assumption. This is not Anthem and United speaking, stating that as long as the group is normally in good standing, they don't often forget to pay their bill, and it's in an industry, which most industries are affected by COVID-19, they'll probably work with that group. But do call them directly and they'll work on that specific case. We are still pending information from the other carriers listed below there. All right, so since groups can't go to their office, maybe can't have access to their checkbook, don't want to go to the post office, etc., there's online payment allowed with all of our carriers always, but maybe the group hasn't taken advantage of that before. This is quick links to tell them where to go for their employer tools for each of our carriers to either online pay right now or ongoing. Moving topics, so this is the other hot topic. If If an employer unfortunately has to reduce hours or furlough employees, a lot of employers still want to provide coverage for employees, even in those situations. So this slide is just addressing in general. We know in the industry, just a quick reminder, that as long as there's one employee that remains active on the policy and the premium is paid, of course, then any of the laid off employees will have continued coverage if they elect it. The carriers only know what you tell them, so if the employer did not term anyone, they're still listed as active employees even though their hours reduced or were furloughed, but the premium is paid. In general, there's probably coverage, and we'll get to specifics on the next slide. And just a reminder that if it is unfortunate and the group actually has to cancel the policy, then there's no coverage for CalCobra or Cobra. You have to have an active policy to be open to extend CalCobra and Cobra coverage. So just remember that that is not an option if the group itself has to cancel its policy. All right, so the details. Aetna, Covered California, and VSP stated we're not going to be policing. So if we don't get terminations, those employees that may have reduced or been furloughed will still have active coverage. Of course, the bill has to be paid by the employer. Anthem and United have addressed specific to this COVID-19 pandemic and have relaxed their official rules to May 31st. So what they're saying is it's okay if you leave people on the plan, even though their hours were decreased to below normal eligibility, or they've been furloughed. As long as there's no discrimination, the policy premium is paid, then everyone listed as active will have coverage through May 31st. And then, we'll see if that has to be extended if they extend it. Guardian is saying they will keep those people active as well until April 30th. That's for all lines of coverage except for disability. So just be aware of that. And of course, the premium has to be paid by the grace period. If an employer does not want to extend coverage, then they clearly just need to terminate the employees. For MetLife, starting March 1, they are giving an approved leave of absence for 60 days, again, assuming premium is paid. And Principal 2 will continue coverage, assuming premium is paid. You get the gist here, that premium must be paid for coverage to continue. And then you can see the carriers that were pending. Next topic, and we don't have everyone's information yet on this. We're still waiting for a couple. So for downgrades mid-year, so you've got a policy in place, maybe it's really rich benefits. They want to keep the policy in place. However, they would like to change the benefits they're offering mid-year to something more affordable based on this unusual situation. Aetna says they'll consider it on a case-by-case basis. Covered California will allow downgrades to other plans that the group already offers, and their date is to June 30th. So as long as there's 3 plans available, employees can move amongst the 3 plans that are offered by that employer through June 30th. Principal 2 is allowing downgrades, and I apologize, we need to correct this. United Healthcare, you can always request an exception on anything, I guess, but they're not necessarily going to be allowing mid-year plan downgrades with United specifically. We're still waiting on answers from the other carriers listed. And I do want to remind people that when you do change benefits mid-year, you need to give a 60-day notice called a material modification per ACA. So that's something to consider. Now, hopefully, once things turn around and we're looking at more positive questions, when we do get to hire people back, how are the rehires handled? Meaning, do they have to wait their waiting period all over again when I rehire them? And every carrier is different. Now, on these 2 slides, I want to call out that we either put what the carrier's response was based on COVID-19 or their normal policy if they hadn't responded. So there's an answer for everyone, but we are waiting to see if their normal policy will change based on COVID-19 for a few, which will be listed. So you see Aetna says that as long as you rehire someone within 1 year, they will not be subject to the waiting period. Anthem has a special COVID-19 policy where if you rehire someone by May 31st, they don't have to wait the waiting period. CalChoice has not responded, so we just listed their normal rehire policy, which you can see as long as they're rehired within 6 months, they can waive the waiting period. And Covered California has no specific new hire rules. What Covered California does is when an employer sends an application in and says, please put Jennifer on the plan, June 1st, they put them on the plan June 1st. They don't question what the employer's telling them. Second slide about rehires is Guardian. This is up to the employer. They just request for processing and operation sake, please send the rehires in batches, not kind of one at a time, just so they can work as smooth as possible when ideally we're back to the new world and we're hiring employees again. HealthNet has not responded, so we put their normal rehire policy in here, which you can see if it's rehired within 30 days, there's no lapse in coverage. And if you're rehired after that, you have to fulfill the waiting period. But we'll see if they come out with something different than that. Kaiser's normal policy is if the employees are rehired in 1 year, they'll be effective for following month, no waiting period required. And MetLife has officially come out and said employees rehired within 6 months will not be subject to a waiting period. And United Healthcare, because of COVID-19, has said they will waive waiting periods for rehires. So even though something was listed for CalChoice and covered California, HealthNet Kaiser, for example, we're waiting to see if they'll change their normal policies like Anthem and United did for COVID-19 situation. All right, so the last slide is just miscellaneous. Aetna has given a free EAP to all their Aetna members, and the information here, there's a number for employees as well as employers. As I mentioned earlier, United Healthcare is actually extending a free EAP to anyone, including non-UHC members, and there's the phone number. UHC is providing weekly call updates, and then a reminder that all of our Anthem and United Healthcare members get a free EAP included in their medical benefits. So that's normal. So I will jump to, I just want to show you where on our webpage we have all this information contained. So if you go to the B&P website, we have a COVID-19 carrier responses section, and this is what it looks like. But what I want to show you is if you go down the page, we have our normal little tabs over to the right with each carrier listed, including the CalChoice carriers like Blue Shield, Oscar, etc. And you can just jump down to whatever carrier you're looking for and see. The information does continue to change, so you can see this is this source of information where we're going to keep it kind of a day-to-day update, minute to minute sometimes actually. So now I'm going to see if there's any questions you guys have. You can just type them in the chat box if you haven't already. Just give me a second here as I open this up for myself. All right, there are some questions. Okay. Thank you for your patience. Oops, sorry, it said my audio wasn't very good. I apologize for that. Hopefully that wasn't everyone's experience. Okay, there was a question about the group premiums, and there's a slide on that. There some carriers are giving a 60-day grace period. Others are saying, and the most of them are saying, call us on a specific group and we'll work with you. We will send out the Anthem EAP phone number that is included on all Anthem medical members. They get a free EAP. Someone's asking how long are carriers allowing people to stay on the plan when the hours have been reduced? It varies by carrier. Some are letting them stay on, like Anthem and United, until May 31st. Some are stating, hey, as long as you leave them on, they can have coverage if the employer wants to keep them active, and we're still waiting for a few of our carriers to respond. There's a question about plan downgrades during the special open window, and I will verify whether, I think that's going to be, we have a question on the plan downgrades, and if they're not allowing them normal, I don't know if they'll be allowing it through the special open window, but that's a good question, and we'll circle back to you. Edda's question on eligibility is essentially as long as the bill is paid, and you don't term them, then they're going to allow them to stay on and they don't have a date for that. The question is, if someone's rehired mid-month and there's no waiting period to wait because they're rehired based on the carrier's policy, do they get coverage mid-month? It's going to be first of the month following their rehire date in general. Okay, I think those are all the questions I see. If I missed any, we'll certainly get back to you. I apologize. And let us know if you have any specific requests for webinar topics. We'd love to be a source of information for you. Just want to know what you're looking for to be of the most support. Quick reminder, please listen to the experts. There's a lot of information out there. The CDC is a great source for everybody. That's at the federal level. And then, of course, the California State Public Health and your local county public health is a great source of information. As a reminder, we will be sending out a copy of this presentation. I will say it changes quite a bit. As you've seen, we're still waiting for a few of our carriers. And as we update it and you reach out to your sales rep and they can give you a new one if you're looking at, I think once it's literally all complete, we'll just go ahead and send that out to everyone so you've got it. But let us know if you need anything in the meantime. Happy to help. And please stay well, hopefully, not totally under your control, but do what you can. Practice social distancing if you have to go out of your house, and stay calm and patient with your family members, and enjoy your pets if you have them. Thank you very much for your time, and we'll talk to you soon.